According to News Bites and the Gale Encyclopedia of Nursing and Allied Health, occupational therapy dates back to the early 1900s as occupational therapists worked with soldiers during World War I to aid with shell shock, amputation, and a slew of other conditions that required therapy in some way. Does anyone know about occupational therapy, or have any of you heard of it? Today I will discuss the interesting and creative profession of occupational therapy. I will reveal what they do, where they work, and what kind of education is required to become an occupational therapist. Turning now to the topic of what exactly is an occupational therapist. Occupational therapy is a holistic, patient-centered, occupation-based approach to life skill development. The mission of an occupational therapist is to enable independence and function in a patient's life. This profession helps patients whose lives have been altered by a physical or mental issue, physical injury, or a variety of other health-related problems regain their daily occupational skills, such as putting on their socks, using a fork, and even taking a bath. Occupational therapy is a very broad career in that a therapist may work with patients that have physical and developmental disabilities, such as spinal cord injuries, brain injuries, patients who have had strokes, patients who were born with their disabilities, such as cerebral palsy and Down syndrome, and even patients who have developed their disabilities, such as Alzheimer's and Parkinson's disease. Equally important to the profession are the different work environments associated with occupational therapy. Occupational therapists will work in 6 broad fields. The first of these fields is rehabilitation disability participation. Then we have productive aging. You'll see them with children and youth. They work within the mental health field, health and wellness, and as well as the work and industry field. The settings that you may find an occupational therapist working are facilities like nursing homes, rehabilitation centers, mental health facilities, schools, foster care residences, and even business-to-business consulting firms that specialize in ergonomics. Occupational therapists may work with and obtain referrals from physicians and nurses, psychiatrists, social workers, courts, teachers, and even patients themselves. As a result of such a broad and sometimes specialized profession, it is understandable that an occupational therapist has a rigorous course of study to break into the field. According to the Accreditation Council for Occupational Therapy Education, a master's degree became required in 2007. And this is known as an MOT program, or Masters of Occupational Therapy. Before this requirement, you only had to have a bachelor's degree in order to obtain a license and practice occupational therapy. Prior to the student's graduation from the MOT program, they are required to complete a supervised fieldwork program through their school. And this is the equivalent of any basic clinical training that you'll see done in most medical fields before the graduation and licensing. So similar to a doctor going through residency or a nurse doing clinical. An occupational therapist is required to be licensed in the state that they practice in, and the potential occupational therapist will sit for their board exams in order to achieve this. Once the occupational therapist has completed their MOT program, obtained their license, and is practicing, advanced and continuing education is needed in order to remain proficient within the field and be successful in the constantly evolving world of healthcare. The practice of occupational therapy has helped so many patients along the way regain their independence when a physical or mental disability took away their capacity to do so. This is a problem that most of us have probably never experienced. The specific work environment that an occupational therapist can be found is varied since the profession is broad and specialized, and as the revision of the old education system for occupational therapy came and went, a much higher degree of education in the form of a master's degree is required in order to become a licensed occupational therapist. With all of the advances in healthcare that we've seen over the years, it's also important that the therapists participate in advanced and continuing education to keep up with the demands of the industry. The Gale Encyclopedia of Nursing and Allied Health says that there is an increased demand for occupational therapists as the baby boomer generation, and these are people that are born between the years of 1945 and 1965, begin to age. There will be a need for practitioners to help with home modification and adaptations that allow for independence as people continue to live longer and longer. Thank you so much for your time as I've described the profession of occupational therapy. I hope your understanding of it has improved and you enjoyed this topic. Thank you so much and have a great day.